Good afternoon. We are starting with the Norma Basalis segment from where we had left. So, focusing on the part of the Norma Basalis where we had left, at the apex of petrous portion of temporal bone, there will be attachment of levator veli palatini muscle. This was the last sentence in my previous segment before few days. Then we come down straight to foramen magnum. This foramen magnum is roughly anterior-posterior diameter is 3.5 centimeter and transverse diameter is 3 centimeter. And this foramen magnum is at the junction of squamous portion of occipital bone, the condylar portion of occipital bone, and this will be the basilar portion of occipital bone. So therefore, now if we consider this much segment just in front of foramen magnum, this is base occiput, which consists of anteriorly the base of the sphenoid, that is the body of the sphenoid, and this structure over here, this will be known as basilar portion of occipital bone. So together the basilar segment of the sphenoid, base of the sphenoid or the body of sphenoid along with the basilar component of occipital bone, so together it is base occiput. And here this tubercle like swelling which is present here, which you can feel with the help of your finger also. And when we teach the students in tutorials, we ask them to palpate, feel this tubercle with the help of index finger. This is called pharyngeal tubercle. Then we come down back again to foramen magnum. As the foramen magnum, the boundaries of foramen magnum anteriorly, this much component, this boundary is formed by basilar portion of occipital bone. Then anterolaterally, these are the two condylar portions of the occipital bone, two occipital condyles. Then posteriorly, this is the margin, posterior margin of foramen magnum, which is completed by squamous portion of occipital bone. So therefore, now the foramen magnum will have two tubercles, number 1 and number 2. These two tubercles are known as jugular tubercles. For example, if I show you in the cut skull, this is the cut skull, then these tubercular swellings will be present here as well as here. Now on these two tubercles, once again I'll replace the skull. On these two tubercles there will be attachment of LR ligaments. LR ligaments are ligaments from the dense process of axis. Axis is cervical number 2 vertebra, and odontoid process is other name of the dens. From that dens there will be attachment of LR ligaments which are attached here. So because of this two attachment of LR ligaments, ALAR, it will divide the entire foramen magnum into two parts, anterior and posterior. Now listen carefully, very interesting and often asked in Viva. What are the structures passing through foramen magnum? The following are the structures passing through foramen magnum. Number 1, from the anterior segment, from the anterior half of the foramen magnum, number 1, apical ligament of dens. Number 2, there will be vertical band of cruciate ligament. And number 3, membrana tectoria. Right now, you just by heart these three ligaments. Later on, during lectures, we will make it clear to you how these three ligaments are attached. All these three ligaments are the ligaments which attach at axis, that is cervical number 2 vertebra, with that of the base occiput. All of them are attached here in the base occiput. So therefore, all the three ligaments, once again from anterior to posterior, apical ligament of dens, number 2, there will be vertical band of cruciate ligament, number 3, membrana tectoria. Now membrana tectoria is the upper continuation of posterior longitudinal ligament of the spine. So the three ligaments will pass through the anterior part of foramen magnum. Therefore, the anterior part of foramen magnum is known as osseo-ligamentous compartment. Now, what are the structures passing through the posterior part of foramen magnum? The following are the structures which will pass through the posterior part of foramen magnum, and that posterior part, as I had told you, is again divided by LR ligaments. The two LR ligaments which are attached to these two tubercular swellings, which will divide the entire foramen magnum into anterior and posterior. And the posterior segment, the following are the structures passing through the posterior part of foramen magnum. Number 1, continuation from inside to outside, that is the spinal medulla or medulla oblongata, which will continue below as spinal cord. Number 2, meninges covering medulla oblongata. We know the meninges, dura mater, arachnoid mater, pia mater. That is number 2. Number 3, fourth part of vertebral artery which will enter the foramen magnum, fourth part of vertebral artery, including its sympathetic plexus. So sympathetic plexus covering the vertebral arteries, structure number 4. Once again, structure number 1, medulla oblongata, structure number 2, meninges, structure number 3, fourth part of vertebral artery, structure number 4, sympathetic plexus surrounding vertebral artery. Then we come to structure number 5, anterior and posterior spinal arteries. Okay, anterior and posterior spinal arteries, structure number 5. Structure number 6, spinal part of accessory nerve, that is 11th cranial nerve. That is structure number 6, spinal part of accessory nerve, 11th cranial nerve. So these are the structures which will pass through the posterior part of foramen magnum, and along with that there is one applied anatomy. Sometimes in some pathological cases there will be passing of posterior part of tonsils, that is the tonsils of cerebellum may herniate out in case of several syndromes. In that case, that will be structure number 7. So these are the structures you have to answer in viva. This is how you have to answer in viva, the structures passing through foramen magnum. Now this is the anterior margin of foramen magnum. What is the structure attached here? In viva, if you are asked, anterior atlanto-occipital membrane is attached here, which will connect with the first cervical. And which is the first cervical vertebra? Atlas. Now coming to this margin. What is this margin? The name of this margin is posterior margin of foramen magnum. What is the structure attached here? The structure which is attached on the posterior margin of foramen magnum will be posterior atlanto-occipital membrane. Again, that is a membrane which will attach here, and below it will be attached to the posterior arch of atlas. Then after foramen magnum, we shift our focus to that of, let us take this 1 and 2. Now both the sides, if you fill with your index finger, there will be depression, and this depression will be known as the condylar fossa or condylar notch like depression, because it is present behind these two occipital condyles. Now these two depressions are present here, so that during extension of the head, this is called extension, this is called flexion. During extension of the head, the condyles can accommodate on the atlas. That is why during extension of the head, because of the presence of these two concavities, the condyles can accommodate on the atlas, because just below these condyles atlas will come. Now comes the viva question. What is this foramen? This is either called condylar foramen or it is called posterior condylar canal. Posterior condylar canal. Now remember one thing. Sometimes it is absent. Sometimes it is present unilateral, and sometimes it is present bilateral. In this case, you can see here it is mostly unilateral, and bilaterally here a very small foramen is present. But we consider this unilateral because this is the foramen. So the name of this foramen, posterior condylar canal. Now what are the structures which will pass through this posterior condylar canal? Following are the structures which will pass through posterior condylar canal. Number 1, emissary vein. Emissary vein which will connect inside sigmoid sinus with outside suboccipital venous sinus. And number 2, meningeal branch of occipital artery will enter through this foramen. Then we come to these two condyles. See here. These two are the occipital condyles. See the convexity and see that they are oval in shaped, bean shaped, convexity, and the axis is directed medially and forwards. The axis is directed medially and forwards. And here these condyles are divided into anterior 1/3, posterior 2/3, anterior 1/3, posterior 2/3. If you pass a transverse line, supposing this is the transverse line, and I am passing across anterior 1/3 and posterior 2/3 of the condyles, both the condyles, then this transverse line will represent the junction between this segment, basilar segment, and this segment, condylar junction, condylar portion, condylar segment. So therefore, the transverse line passing across anterior 1/3 and posterior 2/3 of both the occipital condyles will represent the junction between basilar part of occipital bone and condylar part of occipital bone. Sometimes in viva it is asked. Then we shift our focus to this segment. This is known as the jugular part of occipital bone. Jugular process of occipital bone. Same over here, jugular process of occipital bone. Now why it is called jugular process? Because it will form jugular notch. As we should be able to see here, this is the jugular notch. And this jugular notch is jugular notch of occipital bone, jugular notch of occipital bone, and it will form the posterior wall of this wonderful jugular foramen or jugular canal. This is called jugular canal or jugular foramen. See how wonderful it is. And the entire posterior wall is formed by the jugular notch of occipital bone, which is called the jugular process of occipital bone. Similarly over here, jugular notch of occipital bone or jugular process of occipital bone.